I now note that the hour has come. Ms. McDonald, will you please call the roll to take attendance? Members that are in attendance, will you please indicate that you are present when your name is called?
Councilmember Gilmore Richardson, Councilmember Jones, Councilmember Gaudier, Councilmember Phillips, Councilmember O'Rourke,
Present.
Vice Chair Squilla,
Present.
Chair Driscoll.
Present. Thank you. A quorum of the committee is present, and this hearing is now called to order. This is the public hearing of the Committee on Licenses and Inspections regarding bill numbers 250805 and 250720. Ms. McDonald, will you please read the title of the bills?
Bill number 250805, amending Chapter 9-600 of the Philadelphia Code entitled Services and Other Businesses to add a new exemption for certain business hour restrictions for pharmacies, all under certain terms and conditions. And Bill number 250720, amending Chapter 10-2800 of the Philadelphia Code, Chapter 10-2800, Vehicular Mobile Service Providers, to add new prohibitions on where mobile medical service providers may operate and provide for penalties, all under certain terms and conditions.
Ms. McDonald, will you please call the first panel we have to testify this afternoon on bills 250805?
Deputy Commissioner Francis Healy, Philadelphia Police Department.
Welcome, Deputy Commissioner.
Thank you.
Please state your name for the record and proceed with your testimony.
Sure. Good afternoon, Chairperson Driscoll, Vice Chairperson Squilla, Bill Sponsor, and Councilmember Lozada. Oh, I'm sorry, she's not here. And distinguished members of the Committee on License and Inspections. On behalf of Commissioner Bethel, thank you for the opportunity to testify today in support of Bill number 250805. My name is Deputy Commissioner Francis Healy, and I serve as a Chief of Staff and direct the Office of Legal Affairs for the Philadelphia Police Department. I'm here today to voice our department's full support for Bill number 250805, which seeks to amend Chapter 9-600 of the Philadelphia Code to exempt pharmacies as defined under Section 4 of the Pennsylvania Pharmacy Act from the current business hour limitations that apply to certain commercial establishments. This is a necessary change that will have a meaningful impact on public health, safety, and community well-being. Pharmacies are not just retail businesses, they are essential healthcare providers. Many residents rely on pharmacies for urgent prescriptions, over-the-counter medication, and health consultations, often outside traditional business hours. Restricting their operating hours could delay access to life-saving medication and critical health services. Individuals with chronic conditions, caregivers, and those working non-traditional hours, such as night shift workers, often need access to pharmacies during early hours or early morning or late hours. This exemption ensures these community members are not left without options during emergencies. This bill strikes a careful balance between the maintaining the neighborhood quality of life and ensuring access to essential services. By exempting pharmacies from the 7th District's business hour restrictions, the City of Philadelphia affirms its commitment to health, equity, community safety, and smart regulations. For this reason, the Police Department supports Bill number 250805. At this point, I'd happy to answer any questions.
Thank you for your testimony. I don't think there are any questions. But I do want to recognize that Councilwoman Catherine Gilmore Richardson has joined the panel. Welcome. So I think we're good.
No question? Okay.
Thank you.
Thank you.
Hearing no further questions from members for this panel, and there being no other panels to testify on bills number 250805, we will move on to bill number 250720. Ms. McDonald, will you please call the first panel we have to testify this afternoon on bill number 250720?
Ben Hartung, Public Policy Advisor for the Division of Chronic Disease and Injury Prevention.
Afternoon, Ben. Just please state your name for the record and proceed with your testimony.
Good afternoon, Ben Hartung. Good afternoon, Chair Driscoll, Vice Chair Squilla, and members of the Committee on License and Inspections. My name is Ben Hartung, and I'm the Public Policy Advisor for the Division of Chronic Disease and Injury Prevention of the Philadelphia Department of Public Health. Thank you for the opportunity to testify regarding Bill number 250720 today. The Health Department is currently accepting permit applications for mobile medical service provider permits. These permits are required citywide for all such providers pursuant to a Philadelphia Board of Health regulation entitled the Regulation Relating to Mobile Medical Service Providers. The stated purposes for this regulation are to improve coordination among mobile medical service providers and facilitate opportunities for continuity of care for patients, to improve health outcomes for patients and reduce negative externalities for the communities hosting the mobile medical service providers, and to ensure that mobile medical services are delivered by healthcare practitioners according to appropriate standards of care. I will be happy to answer any questions you have at this time.
Member Work?
Thank you, Mr. Chair. I do have a few questions. I'll just be frank from the get-go that I found it very challenging to digest this when it took another form in a different district. And so just kind of want to get some clarity as it relates to this one. So for the record, the bill restricts any mobile medical service providers from operating in the 6th district, including the ones that receive a permit from the city?
That's my understanding.
Okay. Can you explain how mobile medical service provider permits improve coordination and create opportunities for continuity of care for patients?
Sure. So this is a new system that came from a Board of Health regulation, but also out of
I'm sorry, I couldn't hear you say it one more time.
I said it's a new process that came out of the Board of Health regulation that I mentioned, but it also had the genesis in the bill that applies to the 7th district. We are currently accepting applications, and we've received 4 so far, but the purpose would be for us to understand where each mobile medical service provider is operating, the services so the application requests that they provide their location, the types of services they'll be providing, and the healthcare practitioner's specialty that that'll be overseeing those services. So we're hoping to be able to coordinate all these providers across the city and make sure that, if somebody's operating in West Philly, they're maybe not duplicating services in a very close area, or that at least those 2 providers would be working together if they so choose to operate in the same area. That would be, I guess, an example of coordination of care and getting the standards right for the patients.
How many mobile medical service provider permit applications has the Department of Public Health received since the application was released on November 5th?
So, yeah, the applications were released early November, and we received 4 applications so far. 3 for operation in the 7th Councilmanic District and 1 for operation in the 3rd.
And what's the projected timeline for approval on these permits?
So there's been some back and forth, but 3 are ready for approval in the 7th, but we're coordinating with the Office of Public Safety because they've expressed the desire to operate out of the 265 East Lehigh parking lot, which is going to require coordination of, the three providers. But we're hoping to get those 3 permits issued this week. And there would be no, we're waiting on some supplemental documentation from the one in the 3rd, but there would be no restrictions on their location and operation under the law. So once they receive their permit, they're free to operate at the location they provided us.
So roughly like a 2 or 3 week kind of like timeline.
It depends on each application, but it's it's only been about a week and a half since we received our first application. So yeah, we're hoping to do it quicker than 2 weeks, but once we get up to speed.
Around this time last year, I asked then interim health commissioner Dr. Frank Franklin about mobile healthcare providers. He said that he found this type of care valuable, quote, because there is evidence that services such as these or any other type of harm reduction services improve individuals' outcomes for dealing with and managing opioid use disorder, end quote. How have the restrictions on mobile healthcare providers in the 7th district, to your understanding, affected outcomes for individuals managing opioid use disorder?
So there have been no restrictions enforced to this date, so I don't have that information about the impacts yet. I can just speak to the fact that, as you mentioned, mobile medical service providers are something that happens throughout the country, and it's something that can be billed for, so it's recognized as a standard of care.
You said that you don't know of any restrictions.
The restrictions in the 7th district have not yet been enforced, so the mobile service providers have not changed their operations as of yet, is my understanding.
Over the past year, there have been signs of progress in Kensington. I think it's fair to say. Just last week, the Inquirer reported that there has been a 66% decrease in the number of shootings in the neighborhood. However, the same article reported that due to homeless sweeps in Kensington, the houseless neighbors that we are caring about here are merely moving to other areas of the city. I was shopping in Lowe's, to grabbing something from my house, and saw a few folks in there, in Lowe's in West Philadelphia. These are the sort of examples I'm sure other folks have experience of meeting persons who obviously had been pushed out due to sweeps in interesting spaces and places. So it's moving them to other areas of the city, and they're not receiving the critical housing support that they actually need. This pattern points to the fact that our district borders are porous. What are borders? Individual human beings will migrate as needed, and that folks still need support to access basic needs like housing. How do you predict that this proposed ban on all mobile healthcare providers in the 6th district, in addition to the 7th district restrictions already in place, will affect other areas of the city, given what I'm probably not the only one, have experienced what happens when we do these sweeps?
I don't know that I'm prepared to predict that, unfortunately, but I understand your question.
Okay, all right, that's fair and honest, and I appreciate you answering my questions.
Thank you.
Member Phillips?
Thank you so much, Chair. I just had a quick question about what metrics would the PDPH use to evaluate whether the ban improves neighborhood conditions without worsening public health outcomes? Just, are you having metrics in place to show the impact of this?
Metrics have not been worked out at this time, but the communication with providers is going to be our first step to ensure that certain providers have a patient load at the moment. They have a recurring client list, I guess you'd say, and understanding that if clients continue to see the providers that they've been seeing would be one metric. And I think we'll have to defer to my data team to come up with some other metrics at this time. But.
I'm just curious about showing for example, neighbors have talked about there's recurring litter, discarded needles, medical and human waste, right? Is there a way in which you can begin to make observations, qualitatively or even quantitatively on the conditions of the neighborhood as a result of this change?
Sure. I mean, we do fund and participate in syringe cleanups. So looking at the number of syringes collected per time period would be one metric you could look at. We'd be happy to talk to Clean and Green to see if any of the work they're doing is seeing differences in terms of litter, but that would be
I think that would be helpful for the public to understand the impact of this, like having a data team that can really observe the conditions that have been, just stressful for families, particularly families with children. Mm-hmm. And to see if there's been a change in quality of life as a result, that can be measurable.
Understood.
Thank you, Chair. Thank you, Chairman Driscoll.
Well, thank you, Ben, for your testimony. Thank you for the hard work of your department.
Thank you.
Hearing no further questions from the members of the panel, Ms. McDonald, will you please call the second panel we have to testify this afternoon on Bill number 250720.
Darlene Burton.
Good afternoon. Could you please state your name for the record and proceed with your testimony?
Yes, my name is Darlene Abner Burton. Dear members of City Council, on behalf of the Friends of Harrogate Park, we write to express our strong support for Bill number 250720, legislation aimed at establishing reasonable regulations for vehicular mobile service providers operating within our neighborhoods. As a community organization committed to the safety, well-being, and revitalization of Harrogate, we witness daily the challenging effects. I'm sorry, I'm so nervous. We witness daily the challenges affecting our residents in public spaces. Our board members and volunteers work tirelessly to maintain Harrogate Park and the surrounding blocks, yet we are continued to confront persistent issues, reoccurring litter, disregarded needles, medical and human waste, and frequent crises tied to untreated addiction and mental health conditions occurring directly adjacent to homes, schools, and community areas. These conditions are not only hazardous, but deeply distressing for families, particularly for the children who encounter these scenes on their daily routes. Bill number 250720 provides a necessary framework to ensure that mobile service operations, while valuable in many contexts, are conducted responsibly and with accountability. The legislation does not impede emergency or public health services. Rather, it establishes standards to protect residents by ensuring that any mobile provider operating in our community does so in a manner that respects the people who live here and the public spaces we all share. For years, residents, community leaders, and volunteer groups like ours have been patient, collaborative, and proactive in advocating for cleaner, safer neighborhoods. We have organized cleanups, worked with city partners, and supported local initiatives to promote health and dignity in Harrogate. Even so, the value and impact of unmanaged mobile activity has far exceeded what residents and volunteers can reasonably mitigate on their own. We therefore urge City Council to adopt this legislation and stand alongside the residents who have long been working to bring stability, safety, and respect back to our community. Harrogate is a neighborhood of committed and resilient families who deserves an environment that supports their quality of life and honors their effort to strengthen the place they call home. Thank you for your attention, leadership, and continued support of Harrogate and the 6th District. I would like to say personally that I've been a resident of Harrogate for 29 years. I am one that has been stuck by a needle and had to worry about HIV and have a tough conversation with a man that I've been with for 27 years at the time. Living in Harrogate is a very heavy lift. We deal with things daily that nobody should have to deal with in their community. I did not move there to go and have to endure the things that I have to endure on a daily basis. I moved there for a life for my children. And now I have grandkids who can't come and see me because of where grandmom lives at. It's not fair that we have to endure what we have to endure. No one should live like we do, and no one should go through what we go through. So I ask you to please think of the residents when considering this legislation and this bill. I'll take any questions you guys have.
Darlene, let me first just thank you for, your board's efforts and your volunteer efforts and the miraculous turnaround that has happened at Harrogate Park. I mean, that was because of your team's efforts, no question about it. We're a council, we can only do so much, but when we work together, big things can happen. So I just wanted to state that up front and see if we have any other members have any questions. I think we're good. So,
Okay.
Yes, member at work.
I also want to just thank you for your advocacy to your community. You said 25 years or more?
29.
25,
And
9.
he's talking about a group I started to take back Harrogate Park called the Old Lady Gang. And we're out there every day patrolling just to make sure the kids can come and play without seeing things no child should see. So that's what he's referring to.
I have a particular respect for those who are, as we say, boots on the ground, organizers, advocates, coming out of the community, advocating for the community, whatever it may look like. We may not have the same opinions about the way things should be or how we should approach certain things, but the sort of advocacy that you have demonstrated for the better part of 3 decades is certainly impressive, and my hat tip and respect to you. Could you, for my own understanding, describe for me what mobile medical service providers operating safely and respectfully in your community, what that might look like to you?
So to me, it would look like them operating in an area that's not residential, that doesn't have a school anywhere nearby, because I've personally seen mobile medical providers just dump a bottle of peroxide in an open wound, and all that germs and everything just run on the street. So to me, I understand there's a need for it in our neighborhood because we're inundated with the unhoused. But what I'm asking is, please make them operate somewhere that's non-residential, that's not where schools are and children play, because these kids get exposed to enough on a daily basis. I've seen things I've never wanted to see, and I'm an adult. So the trauma that goes with living in Harrogate and Kensington is unimaginable, guys. I mean, I've seen people literally jump my fence to have sex in my backyard, literally. Drug dealers throwing drugs in my backyard because the cops are coming down the street. My dog getting poisoning because now he's overdosing because he chewed what they threw in my yard. I've been through a lot in my community, but I'm never going to stop advocating, and I'm never going to stop fighting to make it a better community. I ask that they operate in a non-residential area.
Thank you for your response.
Thank you, guys.
And Darlene, thank you for being here today.
Absolutely.
And say hello to everyone for us.
I definitely
Thank
will.
you.
Thank you,
Happy
guys.
Thanksgiving.
You too.
Hearing no further questions from members of this panel, and there being no other panels to testify on the bills before the committee, we will now transition to our public comment session. Ms. McDonald, will you please call the first person making public comment we will have to testify this afternoon on the bills before this committee today?
Kelly Flannery, Sam Pfeiffer.
Do you want to go first? Sure. Okay.
So you can, decide who wants to go first, and just state your name for the record, and you can begin with your testimony.
Sure. Good afternoon, Kelly Flannery. Good afternoon to the Committee on License and Inspections, and thank you for the opportunity to provide comment today. I'm Kelly Flannery, the Policy Director at Positive Women's Network, a national network of trans and cis women and gender diverse people living with HIV. Our Pennsylvania chapter has been organizing in Philadelphia for harm reduction and reproductive justice for over 15 years. I'm here today in strong opposition to Bill 250720. Mobile medical service providers connect people to treatment and reduce barriers to care for people who are vulnerable to HIV, including people who use drugs and people who are unhoused. They're an important way to connect folks to care, prevent HIV transmission, and keep our communities safe. It's notable that the committee is considering this ban right now for 2 reasons. First, this bill would ban mobile medical service providers in the 6th Council District before enforcement of the Public Health Department's citywide regulations has even begun. Moving this bill now suggests a deep mistrust in public health, not allowing the regulatory scheme to be enforced before banning medical service providers from the 6th. Second, because of the Trump administration's racist and anti-poor reign of terror, Philadelphia is losing tens of millions in federal funding that would have otherwise supported healthcare, substance use, and communicable disease prevention efforts. There's already been a 25% across-the-board cut to Ryan White Part B grantees in Pennsylvania. These are folks who ensure that people living with HIV who are low income and have limited or no health insurance can access care and medication. Instead of increasing access to health care in light of this threat, this bill would compound the crises that we're in already. eliminating mobile medical service providers where they're needed at the same time as the Trump administration is decimating funding for the programs and services that people living with HIV and people vulnerable to HIV need to survive. The bill doesn't offer any substitute services or infrastructure. It's pulling healthcare resources out of the 6th Council District. It will result in restricted access to life-saving care, increased HIV transmissions, and preventable deaths. Every member of our community deserves dignity and compassion, not punishment. I implore you to stand up for your most vulnerable constituents and the providers who work tirelessly to care for them by opposing this cruel ban. Thank you.
Thank you, Kelly.
Would you please state your name for the record and proceed with your testimony?
Yeah, hello. My name is Sam Pfeiffer. I'm a community organizer with Positive Women's Network, working directly with women living with HIV and people who use drugs, unhoused residents across Kensington and Northeast Philadelphia. I'm here today because Bill 250720 is not a public health bill, it's a punishment bill, and we need to name that clearly. Kensington and much of the Northeast are already living through overlapping public crises. Philadelphia has one of the highest HIV prevalence rates among any major US city. Over 18,000 people in Philadelphia are living with HIV. And Black and Latinx women account for a disproportionate share of new diagnoses, though women are often left out of the narrative altogether. And yet in a city where HIV, overdose, homelessness intersect every single day, we are debating a bill that would make it illegal for mobile medical providers to show up in entire wards of Northeast Philly. We're debating fines of up to $1,000 for organizations whose whole purpose is to keep people alive and connected to care. What makes this even more outrageous is that the permitting system hasn't even gone into enforcement yet. It's not active until December 1st. We haven't seen a single day of data under the new system, and instead of evaluating it, we are rushing to copy-paste another restriction. We've heard the jurisdiction from Councilman Driscoll's office. We don't want people creeping into the district. I want you to sit with the cruelty of that for a moment. People aren't creeping, they're dying. They are our neighbors, they're your residents, they're human beings who need wound care, HIV testing, PrEP, clean supplies, and connection to services. People could die tomorrow if we take one more point of access away. And all of this is happening while, at the federal level, Trump is slashing the same programs that keep people in Philadelphia alive. He has threatened to gut our health care, roll back protections for people living with HIV, and cut Ryan White funding, the backbone of HIV care and treatment. If these changes move forward, Philadelphia will feel the hit immediately: higher medical costs, fewer providers, and greater barriers to treatment. So please ask yourself, why would we add a second barrier at the local level at the exact same time the federal government is erecting the first? Why would we shrink access to care when everything around us is already shrinking? Harm reduction organizations are already drowning in need. Providers are stretched thin, outreach workers are carrying the emotional labor of entire neighborhoods on their backs. And now, the city is threatening to fine them for trying to save lives. And let's be clear, this bill will not reduce overdoses. It will not reduce HIV. It will not reduce homelessness. It will deepen every single crisis we already have here. If you care about public health, for people living with HIV, for women, for trans folks, for those who use drugs, our unhoused neighbors in Kensington and Northeast, then blocking care providers from entire wards is the last thing you should support. This bill doesn't protect communities, it abandons them, and I urge you to vote no on Bill 250-720. Thank you.
Any members? See, hearing no further, thank you for your testimony. Ms. McDonald, will you please call the next person making public comment?
Crystal Greenberg, Paul Mooney, and Leah Shepard.
Good afternoon. Please state your name for the record and proceed with your testimony.
Hi, my name is Crystal Greenberg. I am speaking to oppose Bill 250720. I'm a nurse treating patients in Kensington, and I actually graduate next week with my psychiatric nurse practitioner degree. I wanted to come here today to share my final research project for my degree, which addresses mobile service units and their positive impact in addiction medicine. Patients with substance use disorder often face barriers accessing conventional medical treatment. Having to go to brick-and-mortar locations to see providers poses difficulties, including issues with proving their identity, long wait times, low provider capacity, and transportation difficulties. To bypass these barriers, mobile service providers are able to meet patients where they're at, engaging them on the street and lowering the effort required to receive medical care. Mobile service units stress accessibility, ethical engagement with the population, non-judgmental care, and flexibility in providing care to patients. Medical systems that adopt mobile service units do so out of an acknowledgement of the failures of the standard medical system in providing care to homeless patients with substance use disorders, and their practices are heavily shaped to respond to these failings. Mobile service units often employ flexible models for treating patients, which allow patients to stay in treatment in ways which are made impossible within the limitations of a brick-and-mortar setting. So I conducted a literature review from various quantitative analysis of mobile buprenorphine and other addiction medicine programs across the U.S. Some of the findings that I found that I thought were pertinent were that mobile service units treat hundreds of thousands of patients annually over thousands of individual encounters. One mobile service unit in Baltimore achieved a retention rate for patients at a median of 15.5 months, while 6 fixed-site establishments only held a median retention rate of 3.9 months for addiction service treatment. One mobile service unit that distributed naloxone reported they received notice of 70 overdose rescues facilitated by the supplies they distributed. One buprenorphine program found that they were able to reach many more patients from underrepresented racial and ethnic groups, or who are homeless and otherwise may not have access to treatment. A study of 468 mobile participants used significantly more outpatient substance use treatment services, 23 percentage point increase, and methadone maintenance, 32 percentage point increase in the comparison group. So the implication for practice is that obviously in May 2025, Philadelphia Mayor Cheryl Parker signed a bill functionally banning the ability for mobile service units to provide medical treatment and supplies to people in the streets in Kensington. With Kensington being the largest open-air drug market in the United States with a substantial homeless population, this legislation has severe, tangible, immediate consequences for those who have been benefiting from the access to care that mobile service units provide. Mobile service units have proven records of making healthcare accessible to those who otherwise would not be able to access it. This legislation is an example of the barriers to care that mobile service units are attempting to rectify. And in order for the obstacles to receiving meaningful, respectful, effective healthcare to be dismantled, the healthcare system needs more creative thinking along the lines of mobile service units that bridge the gap in the traditional healthcare system. But public policy also needs to support these initiatives. This functional ban is an example of lack of evidence-based effective healthcare used for political gain that risks costing whole communities their lives. I strongly urge you not to put this bill into effect. Thank you so much for your time.
And please state your name for the record and proceed with your testimony.
I can go next. Hi there, my name is Paul Mooney. I moved to Philadelphia recently, actually. I was living in DC previously for 6 years, where I was a volunteer mobile service provider for homeless people. And when I first moved here, I reconnected with a childhood friend who turns out actually is now a social worker in Philadelphia. And I was talking to him about the difference in the two cities and different strategies that they have to combat homelessness. And he said to me, well, harm reduction used to be really popular. And I was like, well, what have they replaced it with? And he was like, oh, they replaced it with this bill. So I am here to advise you to not adopt this measure. I have some experience on this as when I was living in DC, we had a similar situation that we had to organize against. The more that things are different between situations, a lot of times the more that they are the same, and I find that to be true with this. What we had is that we were doing mobile service providers within a certain park that was then shut down and swept. It was a large encampment park was shut down and swept and then reopened under BID governance, which is more a thing in DC than it is here, but basically it was operated under a private business group. And we did organizing against them potentially punishing us for providing services in this park. And and as part of that organizing push, I did research into other similar pushes against other volunteer groups, and pretty much every single one looks very the same, where they have a safety claim, whether it's food quality or litter left behind or the safety of the needles that they are providing, which provides a way for services to not be provided, but rather those who are providing them to be taken away. Now, the idea of safety is a very good thing to care about, but when the safety that is being concerned is that people who are treating open wounds on the street might not have the cleanest stuff, it's like, well, that wound needs to be treated. You know, it doesn't take MPH, it takes eyes to understand the necessity of this care. What really these things don't provide is services. What they do really provide is probable cause, because at this point there is no way that a police officer can stop someone providing homeless services because there is no law that they are breaking. What it really provides is a pretense for things to be stopped, because laws are not really being broken when food is being distributed without a license. This is something that is already covered under Good Samaritan laws. These are laws that are redundant, that punish things that are not punishable under more reasonable laws. And so similarly, handing out water bottles from your truck is not a thing that is illegal. It is only illegal when it is done to homeless people. And so that's what really needs to be understood about things like this that have a lot of things that are specific to Philadelphia, but when you read about similar cases in Orlando, in Fort Lauderdale, in Dallas, in Washington, D.C., in Baltimore, similar initiatives, laws, ordinances, it changes place to place. What always happens is that these are just ways to provide reason for police to stop people who are providing services that are very clearly needed. They provide a way for what is just, we would call a total absurdity of you see someone providing help and there's no real human reason that you would have to stop them, but that this gives you a thing on the books that allows you to. And this is what's been stated by others, is that this is not going to provide services, this is going to provide a way to attack people. I find that there's two different ways that people try to combat homelessness. There's combating homelessness and there's combating homeless people. And no homeless person has ever been brought off the street because someone was combating them. And this is somehow a third worst thing, which is combating homeless providers. Time and time again, there's this idea that homeless providers are encouraging homelessness, but this has such a dehumanizing idea if you do not believe that homeless people want to have homes. So really anything that does not go to helping these people is not going to help the issue itself, and that is, I believe, the only guiding principle that should be here, and a true hard look at this shows that this is not meant to help the people that it is stated to help. Thank you.
Yes, please state your name for the record and proceed with your testimony.
My name is Leah Shepard. I'm here to oppose Bill number 250720. I am a resident of Kensington in Council District 7. I deliberated on what to say. I just didn't know what to say. I've said it all before when we tried to oppose the bill in Lozada's district, but I'm going to say a few things again, just to give you some context and why I feel personally connected to this issue. I'm a parent. My child has picked up needles off the street. I worry about my son picking up baggies with stuff in it that looks like candy. I also care for multiple children that have lost a parent to overdose and substance use disorder. And that has left a huge hole in their lives that I'm trying to fill. I've also been homeless. I had to leave all of my belongings except what I could carry, because I knew if I didn't leave, the man I was living with would kill me. So it's really enraging when I hear people talk about things that, rather than helping and to solve a problem, we're just criminalizing the people who are experiencing the problem. My experiences with mobile service providers is that this is a hodgepodge network of people across the city with varying different experiences, life experiences, knowledge. Most of whom are volunteers. I have volunteered with many of these folks, and I have given water, I have given food, I have given clothes, I have made sure people were not dead on the street, made sure they were okay, made sure they were breathing. I have moved people out of the street when they looked like they were getting ready to get hit by a car because they were so high they didn't know what they were doing. It's hard. Sorry, it's so hard to teach a child how to problem solve when your city is just trying to push problems away. Because right now we don't know if there are any, which I doubt there are any benefits of the mobile services ban in District 7. That data, as we've heard already, is not available. And as Councilmember O'Rourke pointed out, what we do know is that, you were talking about the Inquirer article. Right, and it said there's been appears to be less crime and unhoused folks in Kensington. But meanwhile, data is showing that across the city, houselessness is increasing. So what we do know is that people are just being pushed out. We're not solving the problem. We're just criminalizing folks. And I urge you to reconsider other solutions that are more moral, like affordable housing, trash cans on the street. I mean, that would be so easy, right? And overdose prevention sites. I mean, that's really what we're talking about. I mean, I feel for people who I've lived in Kensington for 17 years. I know. I mean, I'm not at KNA. I have spent time at KNA, but sorry, I'll stop now, but.
Well, thank you for your testimony. We appreciate you being here, and I know a member of work has a question.
Thank you for your testimony, and thank you for your vulnerability on that. I actually had a question for Paul, and it's kind of something that you teed up, but also something that you spoke to Paul. Ms. Burton left, but one of my questions was, as someone who does actual advocacy work and has been from the community, around things related to this, what would an effective mobile service providing program look like? She affirmed that the services are actually needed. What she said was, I wish they could be we can delegate, have the folks go somewhere other than residential areas, but recognize and affirm that the services themselves were needed. I am of the conviction, I think it's no secret, that service is ministry, and providing that to people is a moral act. And also, as a practical person, I also hear the concerns that Ms. Burton lifted and others have as well about what is left behind. I've talked to folks in Kensington, had the opportunity to tour with Member Lozada when this conversation came up before, her area, and talked to some of the members and neighbors in the area. And they kind of also affirmed too that, the services actually are helpful, and also it leaves, these issues, whatever these challenges. So my question is, because I know you've recently moved to Philadelphia and you've done mobile service providing work elsewhere. Have you seen, heard, caught wind of any effective, specific legislation being, grand, yes, right? Provide overdose prevention centers, provide affordable housing for folks in a rural way. We're in the midst of many of those conversations right now. But the concern I have, and I had it before and I still have it now, is that we have very clunky tools for civic surgery. Have you seen a bill, some legislation that really kind of like has been effective at getting at the real issue without banning outright something that is a moral act, like providing services in the community?
I mean, I wish that DC had a better example for me to provide with you, but the truth is that saying that you can't do something always is going to result in just, it's carrot or stick. So there are not really ways to, there are not really great ways to put a thing that regulates the provision of care, because regulating the provision of care means that care is not your first priority. And also a lot of these bills that try to strike a balance always talk about moving these things away, but it's never to a specific spot. It's always a vague away. For example, when our park was closed down and then it was reopened, they were like, well, we're gonna have a mobile services center that we're going to have, that we want people to come to, but it was an empty parking lot, which has a bunch of things wrong with it. One, people are at the park because they live in the park. People aren't necessarily going to a place across town, and also there's this sort of sense that the people don't deserve a park and that the park is not for the people, and that there's a second class of people that we don't particularly want here. Now, obviously, the visible signs of poverty are disconcerting, but it's something that you can't really separate away from this. But to say things that are more positively, I think that there are a lot of things that can be helped with very little. For example, people talk about needles on the street all the time. All the time people talk about needles on the street, and yet we don't have a Sharps container that's a garbage can that people can put stuff in. Now that's gonna be ugly. There's no doubt about it. People don't like walking down the street in Kensington and it's like, oh, now we have a needle trash can. And people don't wanna put that up because it seems like you're giving up the fight. And I understand that. I understand that people don't want to see that. I understand. But it's, do you want to see the Sharps containers or do you want to see the Sharps on the ground? It's something that takes willpower politically and doing, I mean, you've seen The Wire. It takes things that do actually get at the root of the problem, but require you to acknowledge the problem in a way that people don't like to acknowledge it out loud.
I have a big imagination, so I imagine in my mind's eye a city that can be able to hold these things and realize these things and create safety for everybody. But I do hear your point around there being a willpower or at least some imagination to see it as well. Thank you for your response.
Yeah, absolutely.
I just wanted to gauge, and I do not mean to hold up the chairman's hearing. Yes, ma'am.
Yeah, go ahead.
Sure.
Yeah, so I believe that actually expanding mobile service units and expanding people's access to them is an incredible way to solve the problem. If we want to see less needles, we need to help people access meaningful recovery if they want to. If we want to see less spread of infectious disease, we need to help people treat their wounds. And I think beyond that, on a policy level, Housing First, which is in Philadelphia would be Pathways for Housing, has shown unbelievable results where people, it's so hard to recover from or to even address substance use when you are unhoused. If you offer people housing and wraparound services, they are able to have a chance to start over. It's shown unbelievable results. So really, instead of, I would say, putting all this money into enforcing bills that are going to reduce access to medical care, that money should go into housing.
Thank you very much. I appreciate you placing that on the public record for our consideration.
Well, thank you for your testimony. Ms. McDonald, will you please call the next person making public comment?
There are no more names for public comment.
Well, I'd like to thank all of our witnesses for joining us today. And this will conclude the hearing. So there'll be no further questions from members of the committee, and no other witnesses to testify on bills number 250805 and 250720. I will ask if there's anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony on the bills being considered today. Hearing none, I want to thank the panels and the witnesses for their participation today. We value your opinions. This concludes the public hearing of the committee. We will now go into a public meeting to consider the action to be taken on the bills before this committee today. Ms. McDonald, will you please call the roll to take attendance? Members that are in attendance, please indicate that you are present when your name is called.
Councilmember Gilmore Richardson. Councilmember Jones. Councilmember Gaudier. Councilmember Phillips. Councilmember O'Rourke. Vice Chair Squilla.
Present.
Chair Driscoll.
Present. The chair recognizes Councilman Squilla for a motion on bill number 250805.
Thank you, Mr. Chair. I move the bill number 250805 be reported to this committee with a favorable recommendation, and further move that the rules of council be suspended and submit the first reading of this bill to the next session of council.
Second.
The chair notes that Councilmember Gilmore Richardson seconds the motion. It has been moved and properly seconded that bill number 250805 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
Aye.
The ayes have it. The motion carries. The chair recognizes Councilmember Squilla for a motion on bill number 250720.
Thank you, Mr. Chair. I move the bill number 250720 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended and submit the first reading of this bill to the next session of council.
Second.
The chair notes for the record that Councilmember Gilmore Richardson seconds the motion. It has been moved and properly seconded that bill number 250720 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
Aye.
Those opposed? Note for the record, one nay. The ayes have it. The motion carries. This concludes the business before the Committee on License Inspection today. Thank you all very much for your attendance.